From the cloture vote, it is now apparent that 60 Democratic senators are in favor of comprehensive health care reform. It is not the bill that I would have preferred. I would like to have seen a strong, robust public option. I would have liked to have seen more clear-cut language on a woman's right to choose, but it has very many important features. It covers 31 million more Americans. It has very important insurance policy reforms. For example, no longer can an insurance company reject a claim because of a pre-existing condition. And except for some technical grandfathering, no longer can there be a lifetime limit on how much coverage there will be. Very importantly, it provides that on a plan like General Motors, 85 cents out of every dollar must be spent on medical care, as opposed to what now goes on reportedly that as much as only 60 cents of every dollar is spent on medical care, with very high insurance company salaries, jets, very, very high expenses. I consider the legislation very similar to the Civil Rights Act of 1965, which was a very good law. But it took a preliminary legislative enactment in 1957 and another in 1964, each incremental steps to set the stage for what was satisfactory and adequate civil rights legislation. And there is a good opportunity to improve this bill in the conference. In order for the bill to go to conference, that is the procedure where the House of Representatives and the Senate sit down together to work out differences in the bills, there has to be a bill which passes the Senate. And it may be that we can return to expanding Medicare. That was introduced as an alternative to a public option very late in the process and perhaps insufficient time for analysis. And perhaps there'll be a greater public understanding of a public option, which doesn't mean private insurance companies are eliminated, just that there is an option, which is what it says, that there is a choice. So that it has been a difficult process, and it is regrettable that there is such divisive partisanship in the Senate today. When we took the cloture vote, every one of the 60 Democrats said aye, every one of the 40 Republicans said nay. It is the same attitude that pervaded the Senate during the stimulus package, which I think was indispensable to avoid a 1929 depression. And I believe that when you have thousands of people dying each year because they don't have insurance or adequate medical care, it is a very significant step forward. And as the comment has been made, this legislation is an important step to seeing to it that adequate health care becomes a right in America and not just a privilege for the wealthy.